Amit. So now next talk is by Dr. Vikram, our chief instructor. He's going to talk on psychological and emotional elements to manage an unhappy patients, and no one is better than him to answer to deal with this talk. Why? Because he is a high volume prolific private practitioner practicing in Gurgaon, where you get all sorts of patients, where most of the patients might need a psychological evaluation also post-operative. He has a high experience of handling various type of patients. So I think Vikram, over to you.
Thank you, Amit. Respected seniors, dear colleagues, good morning. Thank you very much for sparing time on a Sunday morning. The psychological and emotional elements to manage an unhappy patients. You cannot please all the people all the time. The three ingredients to brew a challenging interaction in our setup is number one, we ourselves, our patients, and third, our clinical setup. Each of them have their certain variables which have been mentioned there. And the 3 points of discontentment when interacting with us can happen at all the 3 interaction points. Number one, the preoperative, during the surgery, and the most common and the maximum percentages in the post-op, where we find patients we are not happy with their results. Your system is your reflection. The patient starts forming opinion about you even before he sees you. By the way, how your receptionist talks to him, how he handled as soon as he steps in your setup. Each staff member is very important. Each one has to be competent and efficient. Hospitality is the key word. Your front desk receptionist should always be polite, should be accosting. If a patient asks, is the doctor available, then he or she should be very precise. His time is as vital as your time. Never say the doctor will be there in 10 minutes. Say if the doctor is late on a particular day, the doctor will come maybe around 1 hour later. In the meantime, if you want, you can get your pre-workup done. Never say ki just wait, he'll be there in 10 minutes and then the doctor later comes in an hour or so. That really disturbs the patient. And if your staff has promised we don't know or will get back to you for a particular query by a patient, never forget it and do call back. These are really very simple things, but yes, they help in developing confidence in you and your system. Your waiting area can be very simple. It should be aerated, ventilated, clean. You should have clean drinking water. Basic washroom facilities should be available. That is more than sufficient. Patient don't need more than that, but that should all be clean. Optometrist, who is the first line of interaction with the patient clinically, should just do his work. I find most of the optometrists in setups giving their diagnosis and telling possible treatment modalities. That is not done. Always tell your optometrist, bye, stick to your job. Don't go beyond that. Your junior consultant or optometrist, whosoever takes various questions, should mention those questions in the answers very clearly. Repeating the same set of questions at each station disturbs the patient. Nobody likes to answer same problems again and again. And your counselor should first reach the notes of the consultant before counseling the patient for any particular lens. Few important problems that we encounter here is the patient says, I came before a particular patient, he has already left, but I'm still sitting here. Why? You should be very clear to the patients who are being dilated. Boss, it's going to take you around 1 and 1.5 hours. And do mention you'll have a blurred vision for next 4 to 6 hours. We do get phones in the evening saying, Doctor, what happened? I'm not able to see what I was seeing in the morning. What have you done to my eyes? It does come. This is a very common problem that we face. Then, if you have given an appointment over phone, you should be very clear, yes, this is your time of appointment, but the real waiting period will depend on the ground conditions. Another important aspect, patient says, I came last week, I paid the fees, but I've got no relief. Why should I pay the fees now? This comes up very commonly. In that situation, what we practice is, we just ask once again, the patient says, no, I won't pay. We put the patient in the routine system. He goes to the optometrist, the junior consultant, and then he sees you. By the time he comes to you, he has already waited around half an hour. Then you check him thoroughly. Don't compromise on that. Try and answer all his queries. And before he leaves, tell him, sir, you owe the consultation. Believe me, when you have done your job properly, again, 99.9% patient will pay the consultation. And if there is a VIP patient in your waiting area or another doctor who has come over there for a consultation, never call them by their names. Walk up to them and accost them into your chamber. This will prevent unnecessary mumbling over there in the waiting area. We healthcare professionals should never assume the medical knowledge of any patient. I once had a 65-year-old lady, operated well, good post of vision, 1 month, but she said, I'm not able to read. I said, ma'am, you won't be able to read. You'll have to use glasses for near. She said, why? Aren't they lenses for near? I said, they are. They are multifocal lenses. Then why didn't you tell me? And I was wrong. I didn't counsel or I didn't educate my patient there's something like a multifocal lens. So I lost that patient. And we doctors should be giving appropriate time to our patients, and seriously attending phone calls during consultation is something which if we be on the other side, we would also never like. So I usually leave my phone at the reception, or I put it on a silent mode. These things are really important to have a satisfied patient. The operative part or during the surgery, again, a very important question comes up. I came first in the morning for the surgery. He came late and he's been already operated and sent home. I'm still waiting. Tell the patient, sir, you'll be called around this time. You'll be free around this time. And the sequence is on a very particular protocol, which we follow for all our operative list, so that patient is not disturbed regarding that. Always check the patient data. Always call the patient by their name before the surgery and tell them, sir, you have opted for this lens. There shouldn't be any irrelevant talks or over a phone talks in the OT. And if anything wrong happens, don't press the panic button, stay cool. If something unfortunate complication happens, the best part is tell to the patient just after the surgery. Don't wait for the first post-op day to explain to him. The patient who walks to you in your OPD is not just an ophthalmic problem. He's the sum total of the medical experiences, past and present, of his and of his relatives, for which he has a valid reason. Any visually incapacitating disorder diagnosis can have a profound effect on his life, and he may be disturbed about it. So what psychological strategies you should apply to manage such unhappy patients? Emotional quotient, it is your ability to identify and regulate your feelings and feelings of others around you, something like hypnosis, I would put it. You should always call them by their names, and you should practice the reflective thinking, that is confirming to the patient that you have understood what he's trying to convey. It is like listening and thinking at the same time and conveying it back to him. Keep on listening and understand to the core issues. Approach like the beginner, don't just jump onto the diagnosis or possible modalities of management. Always break down into small compartments the problem so that can be handled. Practice empathy, that is not getting emotionally involved. Always stay calm. And once you have achieved your target or settled the patient, you've satisfied the patient, it's time to have a break. Still, if a patient becomes irrational and he threatens to call the police or media, you have got all the right to remain silent. Speak less, listen more. The patient may be genuinely in trouble. It could be a cry for help. Venting may help him. But remember, don't tolerate disrespect or foul language. Tell him no conversation can proceed under these circumstances. One very important, patient who will just remember what you have said. He won't realize or remember what bullshit he threw at you. This is very important. And never physically handle or manhandle a patient, never be abusive for a patient. In spite of all this, if the patient still blows up, a simple thing, see, sir, you are under CCTV coverage, can help a lot. Always remember, you are much more learned and sophisticated than him. Image building and maintaining is really important for us. We have to maintain our cool at all the time. Over here, I like to share some of my personal experiences. During one such LASIK patient, I had a buttonholing. The patient had naturally a very bad vision post-op. So by 1 week, he was really disturbed. He got to be 1 week post-op. He comes to my clinic with his father and 6-7 other men late in the evening. It was time for us to wind up. And then his father was really angry, as expected for any patient's father. And he said, "Doctor, you messed my son's eye and his life." I said, "Sir, I'm really sorry about that. Yes, there's a complication, but we'll manage it and handle it and give us 3 months time." He said he doesn't have that much time. He has a recruitment next week. Whatever you want to do, you have to do in a week's time. Like I said, I can't do anything about that. You'll have to wait. Okay, no problem. I'm giving you a week's time. I'll coming next week, and I want everything to be fine. So next week, again, he comes at the same time, again with 6, 7 people. And it was really when we were all nearly unfinished. I knew it, he would be coming. But the thing is, you should always hold the bull by the horns. Don't run or escape from the situation. So he again came, same story, everything. They start to shout, and there was no physical violence per se, yeah, but there was a lot of mental abuse. Then one of the patient, the one who had come, maybe he was something, I would say good, that he said, "Doctor Sahab, they have spent a lot of money, they are poor people, they don't have that much money, and the child hasn't got a good vision." I said, "Understand, you refund the money." So I did a refund, I really accept to that, and I refunded the money for one eye, and that is how I saved myself. Though I've lost the patient, and that is, I didn't let the situation aggravate. Another patient had a free flap, and after the surgery, but unfortunately the marking had diminished by the time I reposited the flap, and so even after I asked another colleague, surgeon over there, to check it whether it's epithelium up or down, but still none of us were sure. I told the patient, "Sir, this has happened." His elder brother was sitting over there. He said, "Dekh doctor, kuch ho gaya na mere bhai ki aankh, so you will have it." And these things really disturb you a lot. Then, unfortunately, there were once a series of end-off in my outreach center in the morning. Yesterday, I think just a day before I operated, next in the morning I have a call, "Sir, 2 patients are having end-off." I said, "Just send them over to my center." By the time they came, they were all full of pus. They're really bad situation. I know the situation was very bad. I talked to both the patients frankly then and there. "Sir, we are dealing with a very bad situation. I don't promise you vision now. I just promise to save your eye. And you have got all the right not to have faith in me, because you can obviously already messed up my eye once. I don't have faith in you. In that situation, you are free to go wherever you want to go, get treatment. But then I'm not handling those charges. Yes, I'll do the best and save your eye. I'll whatever comes, and I'm not going to charge a single rupee from you for that." Though there was a lot of shouting over there, but then both the patient relented to take the treatment, and fortunately we could save the eyes. So these are few of the examples that I have been facing. So how to manage unhappy patients? Howsoever good you may try to be and well you may be, but still you can have problems and complaints. Patient always have a valid reason for their problems. You have to validate them, you have to listen to them carefully, and then you have to find solutions to them. Whatever problem is, when the patient, before he comes to you, you see that on your screen or on the sheet that comes to you, the patient is having an issue, maybe he's not having a good vision. What I practically do, before the patient speaks any such thing, I just walk up to the patient and say, "Boss, had I been in your place, I would not have been happy with this vision. This is not the vision which I would have liked." The patient, taken aback, he says, understands, yes, the doctor knows that everything is not fine. So instead of becoming, I would say, aggressive, the patient just waits and tries to listen. And that takes the first steam out of the patient. And you always provide, once you have said that, you always provide options. It should end up in a discussion, not a quarrel. And then options should be not 1, but 2 or 3, which clearly states that yes, you are under control, you have faced such situation, or you know such situation, and you can handle them. Don't forget to summarize the next step you will take, so that patient knows that you are serious and you are surely gonna handle his concern. So, but in spite of all this, sometimes the patient may not be happy or agree to stay with you. And by that moment, you can really understand the patient has already decided to take a second opinion. Always refer him. So, like what I say, your experiences is nothing but the follies that you have committed in your life. Unhappy patients are your greatest source of learning. So, take them as an opportunity to learn something. I know it's not easy while the situation is lasting, it is very tough and it really disturbs you. But if you can practice this, try and handle them positively and stay calm. Thank you. Thank you very much.
Thank you, Vikram. It was nicely summarized and you shared your